So there is this important thing called prior authorization. It's part of a lot of rules that have been made, are being made at the moment. You are working in that area. You are creating the rules. There was a moment in your life where you were a patient in a doctor's room. Well, the day before and the day after, you would be working on that room, but in a doctor's room, you experienced prior authorization yourself, right? So reality, patient, and policy got together. Can you explain a bit more? Can you tell more about that?
Yeah, so my professional and personal lives have collided quite a few times, but this one was fairly recently. Whereas in my professional life, where I'm supporting the industry as we work to understand the best way to implement electronic prior authorization using standards that are going to help us to do this more effectively and efficiently, there was a big debate going on of, well, it shouldn't be in the clinician's office. Like, it shouldn't be part of their day-to-day, their workflow. It should be a back office task. It's administrative. Doctors want nothing to do with this. And in the meantime, I'm going through a huge health event, and I have a doctor who thinks they finally figured out what's wrong, but says, okay, if I'm right, we're going to do one more test, and then we have to do this thing called prior authorization. Like, I know what that is. I think we're good. But he was so adamant that he was going to have to be part of every single piece of this puzzle because it was a clinical decision. If additional information was needed, if there was a question about the care plan he wanted to move forward with, it was life or death for me. And he needed to be part of that process. So he was absolutely clear that he was going to be the one to do it. He was going to follow every piece. He was going to keep me informed as the patient at every step of the way. And that was going to be possible because they did electronic prior authorization. So the next day, I go back to my professional world and inform the debate going on, saying, hey, wait a second. As a patient and with my clinician, this is the reality. We need to do this. We need to give the option of this happening in the clinician's office with the patient. It be that conversation. And because of electronic prior authorization, I got life-saving, life-altering information in 1 hour. In 1 hour, I knew I was going to be able to get the treatment that I needed to be my healthiest self, which I now am, thanks to that.
Thank you for sharing that. It's great to have you as an advocate who can also influence the policies. Thank you for doing that.
Thank you.